Do you have knee pain so bad where it feels like there's glass grinding on the joints? It's burning. You dread long walks. Traveling is a problem. I mean, forget about sports. Because when you have knee pain, looking at this picture right here, well, overall, when this picture on the left is a damaged knee, what actually happens when your knee is damaged overall is you start to have necrosis, avascular necrosis of the knee. The knee becomes arthritic. There's breakdown of the knee joint itself. And when the knee joint breaks down, what happens is the cartilage on the inside, the ligaments, the muscle attachment, it starts to tear up. And when you feel pain, see, arthritis doesn't always cause pain, but how your body feels pain is through the nervous system. When there's an area in your body that has affected the nerves, now the body is saying, hey, there's pain. Because until something affects your nerves, your body won't actually feel pain. Think about it. For me, I've had patients over the last 10 years who've had massive arthritis that have a little bit of pain, and some that have little bit of arthritis and have a major part of pain. Tell me more about how was your knee doing before? Give me a little history about how was your knee doing before.
Well, I had originally damaged my knee when I was probably 14 or 15 years old. And it got better from that and was okay for years. Then it got worse from running and working and, all the things that I did in my life. I know one time I had to be piggybacked from where our office was back down to the house, and because it was so painful I couldn't even walk on it. It was just excruciating. Even being carried, it was killing me.
Right.
So from there, I still worked and ran. I iced it, I would heat it, and it was fine. It did its thing. Probably 10 years ago, I quit running because it hurt. It's painful in Tai Chi sometimes. Then this year, I needed to put some gravel down in my driveway, and I got in and out of my truck, and I realized like 2 or 3 days later that I really strained my knee. It was killing me. It was really bad. Hurting at night, hurting to walk on it, losing range of motion, very painful. And Dr. Tam said maybe I should do the regenerative medicine. So I did.
Right. And how has it been, ever since we suggested it, Dr. Chavez did the injection? How has it been since?
Seemed like I gave more space in the joint, so that felt better, even just, from the minute that it was done. Wearing the braces was kind of difficult over the 2 weeks. And they kind of rubbed on my legs in several places because I kind of kept moving, walking, working,
Right.
But I'd have to say it took about 2 weeks, and it felt like especially my right knee was the problem knee. So I would have pain on the front side of it, on the side of it, on the back of it, on the other side, and the pain would kind of move around my knee when I was walking and working and stuff. So that was kind of interesting, but the pain at night quit. It started getting easier to go up and down the hills. I've been noticing the range of motion is increasing, and it just feels a lot better. Feels much better.
And did the pain that was traveling around, did it stop after a while?
Yes.
Yeah.
Oh yeah, it would be paining here, and then it wouldn't. And then it would start pain on, at another location, and then it would quit, and then it would pain elsewhere and quit.
Right.
So yeah.
Yeah. A big part of that is the rebuilding process. The restructuring and the healing process of the knee. What kind of symptoms in your knees were you feeling before?
I have a terrible pain, burning sensation, stabbing pain. I've been limping a lot. I can't do a lot of stuff that I used to do. I used to do long walks too, but I cannot do anymore. But that's
And did it affect affected your walk? Did it affect your work
It
as well?
affect my work because I work with the babies, and I always go up and down on the floor, and I can't do that. I have to sit on a rocking chair.
Right.
Yes.
And it's been 6 weeks.
Yes,
right?
it's been 6 weeks.
How is it compared to before? How is it now?
After the injection, it felt good. The next day I don't feel the burning sensation. The pain
the next day?
went away. I can move easily, and I slept good too. I've been sleeping good lately,
Right.
because of no more pain.
And how's work now? compared to
Work
before?
is fine. It's good.
Yeah. Are you able to exercise?
Yeah,
Are you able
I
to-
work out, and Dr. Tam gave me a strict diet, and I've been doing that, and I've been exercising, and it's been quite good.
It's been about 6 months.
6 months.
It's
right.
been about 6 months,
6
right?
months, right?
Tell me a little bit more when we first started, before you found out about what we do, right?
Okay. Mm-hmm.
How were your knees doing? What kind of lifestyle? I mean, how bad was it?
My knees were terrible. I couldn't go up and down the stairs at my home. I couldn't walk. I stopped going to the gym because of the pain. I had so much pain in my knee, and I had to use a cane sometimes
Right.
that I just couldn't function right. It was
Right.
terrible.
How long did that last for?
Oh,
And that went on for a little bit,
a long time. A
Right.
long time.
right?
Long time.
How did you hear about us and what we do?
Well, a friend of mine's, she saw your either a commercial or something she
Okay.
saw,
Okay.
and she was telling me about it, and I said, "Oh, I need to go and find out about that."
Right.
And we came to
You came to our
the
seminar.
seminar,
Uh-huh.
and I decided then. I said, "I need to do that. I
Right.
need to do that."
Right.
And I was kind of skeptical at first, but
Right.
then once the injections were done, and each month my knee seemed to improve. There was no pain, no more pain. I could walk. I'm going to the gym now. I walk my dogs every day,
Uh-huh.
and it's great. My
It's
knees
great.
are great. Oh, my knees are so much better. So much better. So much better.
And we just finished taking the x-rays.
Yes.
What did you think?
Oh, they were awesome. Oh, they were awesome. Yes. I couldn't believe it. I was
Yeah.
like, oh my. It was like my right knee was like bone on bone.
Right.
But
right.
now, oh my God. Thank you so much, Dr. Tam.
Absolutely. Thank you. Thank you for believing in us.
Yes.
You know,
Yes.
and there's a lot of people out there that we're helping every
Right.
single month.
Yes.
Mainly what to do after the injections.
Okay.
So afterwards, after the therapy, after the treatment, what you want to do is for 2 weeks, okay, there's no anti-inflammatories. So don't take any anti-inflammatories, which usually you're not big on medications anyways. You know,
No.
like Tylenol, Advils, and all
Right.
that. Can't take that for 2 weeks. All right.
Even the powder you gave me.
Oh, that one's good. Don't worry. That one's all natural. The arthroben, that's perfect. For 1 week, no icing of the area for 1 week. And we've already talked about staying light activity for 1 week.
Right.
There's also exercises. I'll give you a folder that has some exercises for you to do for your knees.
Okay.
And you just start doing them from the beginning
Okay.
and moving up from there.
Okay.
You follow the food management plan and the supplements.
All
So
right.
those would be the things to do, okay,
Ooh,
to
got
ensure
some
success.
homework, huh?
Got a lot of homework. You
Yeah.
got it. You got it.
Ex-
So many people ask me, Dr. Tam, what actually happens when you come into our office? Well, the number one thing that we have to do first is I'm going to sit down with you to try to find out the root cause of your problem. If the problem is in your knee, the problem's in your shoulder, well, where's the problem, right? Then we're going to take you through a complete orthopedic, neurological, and physical exam to really figure out if the problem is actually there. Afterwards, we're going to take some x-rays, okay? With x-rays, we can take knee x-rays, we can also take full spine x-rays for really to see what the real problem is. For example, on this patient's knee x-ray, if we were to zoom out and I could show you a little bit more, you're able to see that she has the right knee here, okay? This is the right side, that's the left side, is she's got spaces in the middle, but it's very much collapsed on the ends. And there's a lot of arthritis happening in this knee. This knee, the top part of the knee is actually shifted over here. So this is the bottom part of the knee. And we're able to really dissect and look at, okay, is it collapsed here? Is it here? In chiropractic, when we look at a spine or a knee, we look at, okay, is adjustment necessary for the knee, or it's also necessary for the spine? In regenerative medicine, we are able to see, okay, what measurements is a good knee versus a bad knee, or the good side versus the bad side? Where's the pain? To really give you a right diagnosis of your problem, okay? This patient obviously has osteoarthritis. She's got narrowing of her knee meniscus, the cartilage, and also extra calcium buildup at the edge of her knees. Well, she's been through a lot, right? So it makes sense. And ultimately, we will make a recommendation. I'll sit down, study, develop, and analyze everything. When you come back the following appointment, we go over your recommendations with you. And then it's not up to me to decide whether or not what care you get. It's really up to you. As a doctor, I believe my job is to figure out what's the problem, the cause of the problem, what can we do about it? Is it something that's fixable and patchable? How long it's going to take? I present everything to you, and then you as the patient, I like to empower our patients to decide what you like to do. So if that's something that you are interested in, well, let us know. You know where we are. Have a great day.